you. Hello and welcome to Wellness Live. My name is Dr. Olivia Moses, and thank you so much for joining us today. This presentation is brought to you by the Loma University Department of Risk Management and our Living Whole Wellness Program. Well, if you are watching us live, it's November, and we are in the season of Thanksgiving. And I cannot tell you how excited I am when Thanksgiving rolls around. And one of the things when it comes to being thankful and grateful for things happening around us, I think one of the things that we start to think about is how can we give back? What are there things that we can do to be of service to others? And so I have invited our Global Health Institute to come and present to us today. They are kind of the hub of where all of our international services work here at Loma Linda University Health, and they do amazing work, not only here on campus and a representation of what we do, but all over the world. So I'd like to introduce you to Mo Riley. She's the Director of Global Operations, and Angeli Yutuc, who is also the Manager of Global Outreach here at Loma Linda for our GHI. I cannot be more excited to introduce you to these powerhouse women who do such amazing work on behalf of our organization all around the world. And I am so excited for them to share what they do for their work and also what we can do to spread thankfulness and gratefulness from our hearts to improve somebody else. So without further ado, I'd like to introduce you to the staff at Global Health.
Thank you, Dr. Moses. Thanks for having us today on this episode. And since this program is geared toward health and wellness, we wanted to start about talking about why serve. If we can pull up our PowerPoint. These are a few benefits that we've discovered, as well as when folks serve and come back. This is some of their feedback. Service helps grow our personal worldview and develops culture of humility. It encourages an understanding and respect of other cultures. And it also offers an opportunity to reflect on what makes us different, as well as the similarities that we share. And in this world and these days and times, you can certainly use more understanding and compassion. It also gives us a chance to learn from different practice settings. Our clinicians, our residents, and students are exposed to different diseases and treatments. And we can also influence and improve the health outcomes in our international communities. It also helps us practice gratitude and selflessness and moving our focus on those people and their needs that we serve. Through service, we can develop meaningful partnerships and relationships. This is particularly helpful in an academic setting such as ours. There's a lot of exchanges and research and projects that result from this, as well as developing local capacity. So it's a reciprocal benefit, benefiting both us here in the United States as well as our partners around the world. And many of the participants on these trips come back and share that the experience has been, transformational, both personally and professionally. And we should note, of course, service can be local or international. For the purpose of today, we're focusing on international service. So it's no surprise that Loma Linda University Health has such a focus on mission service when you consider that our founding fathers, so this is John Burden, he said it was for this, sending health workers overseas, that Loma Linda was brought into existence, and it is for this that we should all live. From the very beginning, Loma Linda was oriented towards serving those in need and serving abroad. And between the years of 1900 and 1950, over 100 Adventist hospitals were started around the world. That's approximately 2 every year. And these hospitals were largely started by Loma Linda University alumni and those faculty as well, those associated with Loma Linda. In 2007, the Global Health Institute was founded as sort of an umbrella entity to coordinate all of the different international initiatives and projects and requests that would come into Loma Linda for assistance internationally. And now I'm going to turn it over to Angeli, who will be talking about some of the programs that are offered through our institute.
Thanks, Mo. So many of you have probably heard about our Students for International Mission Service SIMS program, which offers opportunities for multidisciplinary and school-based student group trips and rotations. They're a very busy office and arrange over 40 trips a year. We also have an ISP program, International Service, for our employees and select consultants to serve abroad in short-term capacities or on specialty team trips. And on this slide, you can see that not all of them are necessarily clinical. We have construction teams and electrical teams that go out, administrative as well. So if it can serve well in a healthcare setting, then we can definitely use your help. Our ISP program also serves our different residency training programs to offer international rotations. So we often think of medical residents, but we also have nursing residents and management residents on campus as well that take advantage of this opportunity, and they thoroughly enjoy getting to work in a different setting. For those of our alumni here at Loma Linda that are interested in doing long-term mission service, maybe a year, maybe 5 years, maybe a career overseas, we have the Deferred Mission Appointee Program and the Global Service Award. And it provides an opportunity for new grads to go overseas right away because there is educational loan repayment assistance. And so for those that are interested, we encourage them to reach out and learn more about these programs. As Mo mentioned, it's very important to have a reciprocal approach and to benefit the sites that we're working with and have a true partnership. So our International Professional Development Program provides opportunities for professionals from our long-term partner sites to come to our campus and to exchange ideas, further their training, and hone skills that they can take back with them to their home institutions. So GHI also has a number of different virtual and in-person educational and training initiatives that we support. So it really is quite special. We often get asked who Loma Linda's international partner sites are. So while the institution looks to be supportive of Adventist hospitals and clinics and institutions around the world, many of which are Adventist Health International partners, we have designated a few global campuses to be hubs of concentrated activities and exchanges in their respective regions. The first that was approved is our global campus in Malawi. And you can see here that there are many different pieces of involvement that we have with the site. We have long-term missionaries, we have specialty teams that go, short-term resident and student rotations, and so on. And so it's neat to see how that is now affecting training in the region, healthcare accessibility, and a lot of other factors. So there will be time for more questions at the end as well, but we did want to share contact information in case there is anyone interested in reaching out.
Thank you, Angeli. What does international service look like? We wanted to highlight Dr. David López. Dr. López is professor of the School of Allied Health Professions and chair of Cardiopulmonary Sciences. For over the past 40 years, Dr. López has been involved in many different programs and initiatives around the world, and he'll be talking about the impact of international mission. Dr. López?
Thank you, Mo, and thank you, Angeli, and also thank you, Dr. Moses, for this opportunity. I feel like it's a privilege to share what has been provided and been able to do over the years. It seems like it's gone so quickly. But basically, what I want to talk today about, the title is Translational Mission-Focused Service Learning and Loma University's Health International Service and the impact it has on not just us, but other people as well. Next slide, please. Some quick objectives I want to talk about is, I'm going to go through these very quickly. Just opportunities, talk about opportunities that exist and how we can get involved in different areas. Some clinical and educational service opportunities. There's both sides of this. There's also pathways for involvement in diverse areas and methods, and some of the outcomes in terms of professional and personal growth that can happen. I was just thinking about some of what Mo was saying and Angeli about Global Health Institute and the mission of Loma University. And one of the things that kind of came to mind, in addition to the benefits that service has, there's a lot of research that's been done in terms of longevity and health benefits, cognitive benefits with people who do serve. So I want to add that's also been something that is part of what service is about. It can help you live longer. It does make your health better, and having a focus in that. So I want to talk about this first topic. Has to do with translational mission focused service learning. That's a lot to take in, but basically what it comes down to is basically each one of us in healthcare have a clinical role primarily, and that's kind of how I started. I'll talk about more of that in a bit. But that healthcare role basically is working with patients. We work as a team. We work with other people. And part of that service and work we do with other people has a direct benefit, obviously, with patients. Now, when you're going to translate this into international work, service learning mission, it's basically taking what you have, what you've learned, and applying it to a different setting. And I kind of relate this sometimes when I'm working with patients, their families, as an example. How do I take what I know I'm trying to treat this person, the client, the person I'm dealing with, the patient, and make it understandable to them? So I have to translate what I know medically in healthcare into something that they can understand. Sometimes it can be very technical, and I have to bring it down so that they can understand. So we both agree, and there's some education involved with that. We're all involved with that here in Loma Linda. And being able to translate that now into service internationally is kind of where I'm going with this. So we have a good base of knowledge. If you're a type of person who likes working as a team, you're always interested in helping people's in terms of their outcomes, improving what they're doing. And this is a good method of something that you can do. So basically implementing best practices that you have in what you do. I'll get into more of that in a second, but again, take what you have, what you've learned, your specialty, improve on that, make that the best, and people will start looking for you. I didn't begin looking to do service. It just kind of came to me. People saw what I was doing in terms of how I would talk to patients, the families, and they said, "Well, would you be interested in doing this in another area?" And I'll get into a little more detail on that in a bit. Some examples of some of the translational service that we've done that I've been involved with. One of them is the Life Support Education Center here at Loma Linda. This is an American Heart Association training center, and we've done just the regular basic life support, advanced life support, pediatric, NRP to different countries. Why? A lot of times people ask for it. People want to know what's going on in the U.S. They want to have good outcomes like we do in the United States and in Loma Linda. So that they'll reach out to us and say, "Well, can you come over and teach some of these life support courses for us?" And we learned very early that we don't want to go over and just teach and give them a certificate. That's very limiting. These only last for a couple of years because science, technology, research continues to grow, And in the process of this, it basically has to be updated. So our goal on a number of these places was to also do a train the trainer, train instructors, get them involved with their local American Heart Association group so they could continue this as we went on. And this has been true to a number of sites, Adventist sites as well as global health sites we've done over the years. Some of them that I forgot to mention here, we've also done work in Vietnam, in Colombia, and Myanmar. I forgot to add those to what we were doing, but I guess Colombia is not in that list, but we were also there and did train the trainer, partnering with them and the American Heart Association. So we have a good connection with that and a number of things that we can do. Also, the profession of respiratory care. Some people will ask, well, what's respiratory doing there? The typical example is they want physicians, they want nurses, but there's a number of other allied health fields that are also part of the healthcare team. As countries have grown, they've gotten bigger, technology kind of bleeds across borders now. Countries, hospitals, governments will want to improve the healthcare of their people as well. And they will they try to go out and get the best that they can find. They'll order equipment, anything from state-of-the-art MRI machines, they'll get mechanical ventilators, all this equipment, and then they look around and say, well, who can run these things? So they've reached out to us in those areas. For example, in respiratory care, they'll get mechanical ventilators, pulmonary function testing equipment, arterial blood gas equipment, and they want to know how do I use this in my hospital? Can you come and help teach this? So we've gone over and adapted our curriculum to either teach small focused areas. We've done collaborations with helping them do whole curriculums for programs for initiation into their country, because most countries don't have respiratory care, only a very few around the country. But the expertise and technology can be developed there, and we've been very fortunate and had very good outcomes in terms of giving them the support needed so they can grow that in their country. And there's a number of countries we've established respiratory care that has helped out in the healthcare in the country as well. I always like this quote from Gandhi: "The best way to serve yourself is to lose yourself in the service of others." And that's kind of what happens. You're helping out people and you're doing it and you don't even know the impact that it has and what other people are getting out of you being there. They come by later and talk to me. You remember we were here, you were here, and we talked about this and this. We were able to use that and make that grow. It's been quite enlightening to see, for example, in China, we were there probably from our school, Allied Health, in the 1990s, early 1990s, went to Chengdu, also to the one of the premier medical universities in China, Southwest Medical University. And we took our curriculum, talked to the faculty at that time. And since then, they've grown from a bachelor's, a master's, and now they have a PhD in respiratory care. So they're one of the major areas that are teaching respiratory and providing practitioners there as well, and physicians. Again, a lot of this has to do now more with people want what works. They want good outcomes. Well, how do you get those? One of the nice things in terms of technology, people do have access to the internet. We can interact and collaborate a lot more quickly if we can't do it face to face. And there's a lot of information and resources that we can help direct some of our partners and people that are interested as well. My personal experience has been, I say, some very multi-dimensional service. I've worked as a therapist. I've worked as an educator. I've worked in the life support education area in a number of countries. And just, again, the translational part of this, I've been able and fortunate to pick it a little bit here, pick it a little bit there. And when they have needs for us, we're able to help with that. My first foray into international service was from the Overseas Heart Team at Loma. I was in Saudi Arabia I had no idea I was going to be asked to do this. Again, I worked at the cardiothoracic unit on 7100 at the medical center. That's where the heart surgeries, later the transplants would take place. They also had a small room with 3 or 4 beds for babies. So occasionally I would float down into that area. I worked there, and I enjoyed the work. And I was told that I did a very good job. And they kept asking for me to come back to that. They'd asked the department, can you send David back to the unit for us so we have these patients coming? And they were asking me to come back. So, well, sure, I enjoy it. So I went there. In time when the collaborations with Saudi Arabia began back in the early 1980s, they asked me about going to Saudi Arabia for some work there. And the main focus there was to begin a respiratory education program. So because it was part clinical and part teaching, we were over there with Dr. Nelson. At the time, we were both therapists, and we worked part-time in the clinic with patients, helping recovery the adults and the babies and the heart team there with the collaborations that we had, and the other part we would teach. So we developed that program in collaboration with the education group there. Years later, we did an associate degree, then a bachelor's degree, and the profession has pretty much taken off in their country the way it fits best for them, which has been very gratifying to see. We have a few hundred graduates that are the directors, leaders, and vice presidents in a number of the hospitals now over there. So again, we've been a number of different countries, done a number of different partnerships that are very similar to that with the heart team. Some long-term partnerships and relationships, again, has to do with the education part of it. And again, a lot of times people will notice very quickly, we need more infrastructure in terms of helping the country, helping their people in terms of improving their healthcare. And it always comes back to, well, we can go over for a few weeks and do a heart team type of thing, and they learn something, but they really want to start a program in respiratory in their country. So there's examples we have in China, Saudi Arabia, Taiwan, Peru, currently working on in Japan. We've shared education curriculum, continue to do that, and it's been very gratifying to see how this takes off. This isn't something that happens overnight. It's the average is probably about 8 to 12 years that this takes. To get a government to recognize a new profession is very difficult, and it takes time. We're also working with Ghana as well, and some other countries here in Costa Rica and Guatemala as well. So again, the application of the curriculum profession in other medical education worldwide is not just to help in educating new respiratory therapists, but also in helping out the medical community as well. We also conduct classes in and for physicians and nurses that also have a big part in what happens with respiratory care. Some additional options in terms of pathways. And again, some of this has to do with the goals that the institution or entity might have, and with yours as well. Again, if this is something that you're interested, you have a calling to do, you want to try this out, there's a number of short-term missions. There's a number of service trips that people have. Mo and Angeli mentioned a number of them here. We've had our students go on a number of these, which they come back changed. Anytime you do service to anybody else, it does change you. It helps you. I know research that's been done, and I did some myself years ago, that if you do research, service, you'll always come back and you want to do more. So even though you might have done it for a couple of weeks or a couple of days, some programs would require it. They always do more when they're done with it. There's also, again, long-term collaborations and partnerships are available, reaching out, and I'll talk more about some of those, how to get about doing those. In-person remote teaching, that's been a big help in terms of remote teaching and collaboration. We've done that in a number of countries. That's worked out very well. It's working a lot better. Also had mentoring programs where we've had people when it's possible to bring them over, and shadowing. I think Angeli mentioned a number of those when they come over to Loma Linda, and that's helpful as well. So we have provided training, education to students, also potential faculty, physicians, and others that have wanted to develop more background in terms of respiratory care. Just some personal and professional impacts that this has had. Personally, it's been a lifelong learning process for me. I continue to learn about healthcare and medicine from other countries. They do things differently, and I learned from that. I know early on with the heart team, I was used to working at the medical center where we had all the technology up to look at. We could always figure out that just by looking all these different things. You go into other countries that don't have as much technology, and you have to rely on your assessment skills. You know, what's the best way to look and see if a patient has hypoxemia? Do they have anemia? You know, if you don't have all the technology you have, what are some of the things you can fall back on? And that's always been a huge benefit to me professionally and personally, because it makes a lot of the technology make a lot more sense. Learning new cultures, new languages. The food is always interesting and fun. But again, I've always enjoyed that. Cross-cultural friendships. In all these countries that we've been in, I still have friends that email me. Some of them will still send letters. But again, those relationships continue, and it's been gratifying to see that. From a professional growth standpoint, this has been always good, because when we help them with what we have to offer, they share us what they're doing, and that also helps with our treatment methods, models that we do here, to compare it to what other people do. And sometimes we will look at things, and they will have something that's better than what we're doing, and that's okay. That's part of the collaboration. So we've updated our own curriculum. We have service learning opportunities that our students need to do in terms of in the community. We also have available in allied health that they can also go to international service as well. We're always open to doing more of these. Also, international research collaborations. We've done this with a number of countries, and I'll show you a list of those that we have and some additional opportunities. But that's been a very good opportunity for our faculty, for other healthcare providers in other countries to work with us, and doing research that specifically benefits them as well. So having that mentorship that we help them out with has been very, very helpful and beneficial. So applying some of these to various institutions. Again, some places don't know that they could do this or want to do this. Sometimes it can come from external sources. It can come from a government, it can come from a church, it can come from a community service area, and they will basically start to build collaborations and how to build a group that helps meet the needs of what these communities, the hospitals or the institutions might look for or might want to do. So it's basically looking for how to customize what you want to do to apply that to a particular site. Again, the short-term and long-term partnerships. Again, you're looking at low resources in terms of what's available and money, and high resource settings. Low resource settings because of the internet. You have things like Zoom. You have things like just a number of things you have on the internet in terms of clinical practice guidelines that different professions have to help build this, where you don't need a lot of intensive work. So that's helped out a lot. In terms of the next generation of where are we moving forward, again, the basically need and call is that if you have a specialty, and I want to say you're all special, all healthcare providers are special. You're working with people, you know what it's like to work in a group and help people. I extend that a little bit more. You like sharing with people so for them to understand more of what their illnesses are, what their treatments that they're going through, what they're going through. That's a little bit more. If you also like working as a team, these are the types of people that we're looking for. People that are going to go out, engage, and want to help out. Again, they're great experiences, and the opportunities are varied. And these opportunities, again, can come from mission trips. They can come from partnering at conferences. They can be with programs, so within and without Loma University Health. I can recall back in doing more health, conferences with attending conferences when we were with the heart team, and we'd go to a conference like the American Thoracic Society, and we knew that there was a need for, a pulmonary function machine or a blood gas machine or ventilators at a particular country that we're at. And basically what would happen is that we'd go to some of the vendors that sell these things, and we'd ask to talk to the person in their company that was involved with international sales. And each company had different ways of doing this, but they always had some type of a fund or equipment or something that they could provide. So there was a number of things that could be available in terms of not just going, and hoping something falls out of the sky. But sometimes we'd go ask, and there was always equipment or funds available that would help. Sometimes it would be as simple as, well, we don't have any equipment, but we can help send the equipment for free when you guys go somewhere. So it's a lot of things that we could collaborate on that would really help. So again, your people that you know, people that you work with, can be in the hospital, community, churches, they all help. And word of mouth obviously is very helpful, because you're going to hear about these things. Ask how you can help. Sometimes it can be as simple as something as easy as this presentation today. You hear about it, want to know more about it, where can you do that? So word of mouth is always very big if you're interested. And the other side of word of mouth is that when you do a good job as a practitioner, people will come looking for you too. So I do believe that the Lord helps us in terms of what we need to do. And sometimes when we don't know what we're supposed to do, He'll come and find you and put you in areas as well. This next slide base has a lot of citations. These are the most recent publications we've done with some of our international partners. These are physicians. These are also some of our master's students, and we've done things. And the first one here is from Ghana. It's also from done with India. There's society. Can you read through these? Saudi Arabia. Another one from Ghana, United Arab Emirates, another one from Saudi. Oh. So again, there's a number of areas in terms of the academic, the research side of it, that brings in not only the bedside types of research that people want to do, but also the education parts of these that are also beneficial to other countries and institutions. Some pending completion and publications we're doing. Again, I mentioned Guatemala, the United Arab Emirates, some more in Saudi Arabia, other places in terms of continuing with India, and also Taiwan that we're working with as well. Again, this has been a very inspiring part of my life, because I never know what's going to happen next. We'll get calls and people will say, do you know anything about this? Sometimes I have to say no, but we'll find out. We'll find out together. There's a lot of resources that we can reach out to that are very helpful. And that's something that I want to make sure that we can continue, and the next generation will continue that.
Okay, well, thank you so much, Dr. Lopez. And it is very interesting to hear about your international service. We are a little bit out of time, but I wanted to make sure that we had some questions to kind of clear, to make sure our audience knows a couple things about international service here at Loma Linda. So the question is, this presentation was focused a lot about clinical service. What if I'm not clinical and I want to serve? Is it just for clinical individuals, or can other people actually join as well?
I'll give my 2 cents, but I know Mo and Angeli probably have more of that. But again, the areas from a non-clinical standpoint usually has to do with research. If someone's interested in research and they want to help out with those types of areas, that's an area that can help out. There's also the medical education side of it that people can help out with. And I also want to, I think I mentioned it, I had it in a slide, but didn't mention it. There's a number of opportunities that people have with community-based programs. There's health fairs that people do that people can get involved with, and that can also lead to a lot of international issues and opportunities. I know a lot of the things we would do overseas with the heart team, and even with the academic side, it's part of our outreach as Loma Linda that we will do things like have a health fair where sometimes people have never had a health fair before. And that's other things that we can do to bring in people that help out with those types of endeavors. They can be as simple as helping with with logistics, with the equipment gathering, helping keep records and things like that. So that's also important.
And sometimes people are not able to travel overseas. So what can they do from here locally? We get donations. People donate, use medical equipment and supplies here to GHI that we in turn triage and send overseas. One of the programs that Angeli mentioned where the professionals come here to Loma Linda, we're always looking for volunteers to host some of these folks and speak English with them, take them to lunch, or take them on a weekend trip. So you don't have to be clinical to participate in international service.
Yeah, and I also want to add that brings me an example a few years ago that we had we were somewhere and we needed a translator, and that translator came and translated for us. Went back a number of years later, that person had come to Loma Linda. I had met them here. They had also taken nursing and had continued on. So they started off as a translator. They had nothing to do with healthcare, but ultimately they made enough connections and networking that she wanted to continue that kind of service, not only with translation, but also service in her country.
Well, thank you. So we're a bit out of time, but I want to ask this one last question. If, I think a lot of us are looking at the world and there's a lot of pain, we're seeing war, there are all kinds of things that are happening. And I feel like I just want to serve. What can I do? What advice do you have for someone who is looking to serve?
I guess I would say get involved, find out. I mean, the GHI has a lot of wonderful opportunities and resources. Reach out to people. If you're, again, clinical or non-clinical, that's a good place to start here at Loma Linda. The clinical people, it's a little bit easier because you work with a lot of groups that want to go places. So ultimately, they find their way back to GHI. I know I'll get a lot of comments or questions about, can we do this over here? We have a group going. Well, great idea. GHI can help you. They're the resource. They're the pathway to service. So as far as from my point of view, that's probably what I would do is start there and communicating and collaborating with them.
Now, am I correct that they can email you? Angeli, I believe you put up the information on how to contact the Global Health Institute and also to see, to learn more from your website. Could you share your contact information with us one more time?
Yes, certainly. We'll try to get that back up on the screen. GHI service at llu.edu is our email address. And you can also reach us on our website, ghi.llu.edu, to see more about our programs and to reach out to find out how you can get involved.
Okay. Well, great. Thank you so much, each one of you, for being here today. And I also want to thank all of our viewers. Thank you for joining us and for learning more about what we're doing here at Loma Linda University and our Global Health Institute. I want to invite you for our last Wellness Live of the year, which will be December 12. That's a Thursday, as usual. And we will have Dr. Dillis Brooks. She's one of our associate chaplains here at Loma Linda University, and she has an end of the year message that you won't want to miss. Thank you so much for being here, and we'll see you next time.